Okay.
Hey, welcome back, folks. After a brief floor session, okay, we're picking back up with our budget adjustment discussion. We left off on Vermont legal aid, and any potential recommendations. We had a proposal on the floor to, just to refresh people's memories, because I know, it can come in and go out as quickly as it happens. So they requested $635,620 through budget adjustment. They were looking at 235,000 of that to be a 3% increase, a COLA increase, essentially for base years for 3 fiscal years. That is something that we will not be considering. Any of the COLA increases were dealt with in the budget, and if they didn't get one, that means the decision was made not to give them one. So we will, I'm sure, take it up again in the FY27 budget process. So that brings us back down to the request for 2 full-time attorneys / staff. PLP, what's that word? Remind me what that means, PLP?
Poverty law project.
Poverty law project, okay. So you can see in their services summary at the top of that page, the what they have been providing in terms of that service. Okay, so they are looking for 2 attorneys there and $100,000 for staffing the helpline, funding for increasing staffing to the helpline. So, and you can see on the legal helpline, the increase has been substantial between the last 3 years, doubling in the last 3 years, and anticipated to continue to increase as the federal changes come down and impact people on a personal level. I think that Doug had put on the table a proposal or a thing to consider, which was 1 staff. So that'd be 150,000, and then the helpline funding. And
I'm sorry, what was that? What would the amount be of the helpline funding?
100,000.
100,000. Thank you.
So the total would be 250,000. That's about that proposal on the table.
I support that. In my work outside the legislature, I've had to work with some of my case managers and the people they support to ensure folks, these instances were all so that they could stay housed and not re-enter homelessness, which would have cost, our state a lot more money than the time, that's that part of the attorney's time. And when you add that all up, I feel it's a lot more efficient use of our resources than allowing these people that they're assisting to struggle and to ultimately end up in really more dire situations that cost that will impact our budget in larger ways going forward.
So I'm trying to understand their FTE summary. Can somebody help me understand? It's at the top of their 2nd page.
Oh.
It says that they in FY26 they're looking at 11.8 staff. In FY25 they had 12.6. FY24 12.7. So I guess I'm asking you, Doug, is your proposal just to restore them to what their previous was? They appear to be asking for more than what their previous was, if that's the program that we're talking about supporting. I'm asking Doug a question.
Yes,
I guess this raises an additional question for me, to be honest with you, is they gave us some numbers about the loss of staff, I'm sorry, where's that? And I'm not seeing it on that chart, so I don't know if that's a different program. But they talked about a fairly significant, and I don't know if they were going further back in time than what we see on that table, or if it's for a different program, but they referred to, I have a thought.
Go ahead.
I think that I'm wondering if this is the PLP program only, not their entire staff would be my guess.
Yeah.
And so-
Well, that's what we're looking at.
Yeah.
That chart references their.
But they had been talking about, at one point, they had 19 lawyers working in the firm. I think we might be a little confused. That loss they were talking about was 10 lawyers down. And
Yeah, we're not going to replace the people who are working under E ERAP.
I get that.
Yeah.
I'm just trying to justify or not just make sense of what that big gap they were talking about. And it isn't a big gap.
In that,
here.
yeah, gotcha.
Yeah, I guess I'm not, yeah, 9 attorneys, 2 paralegals, and which programs they worked for. I'm not clear if it was ERAP or it was other programs. So,
So I'm going to kind of, I guess, offer an alternate view of this. And it's not because, okay, hold on just a second. Can you? I'll offer my alternate view.
I don't know what that is. We'll just wait a minute.
I can say one more thing, and that's that Doug's recommendation of adding one staff member back would get them a tiny bit higher than they were in fiscal year
basically
24.
Yeah,
And so it's
which
actually,
is kind of what I think Teresa was asking, like,
Yeah.
what's the recommendation to kind of go back to?
do we know if those lost HUD dollars, the 1.275 million, are PLP related?
I don't know.
It sounds like they are shifting monies around, so money that used to go to TLP is now going to other mandatory legal services such as involuntary mental health treatment, so it's kind of not a one-for-one.
Yeah.
But they're having to shift within their own functioning.
yeah, it looks like their mandated services have only increased. Well, yeah, that's what you're saying, right? While other things have gone down.
Yeah, and so they've had to adjust with that.
Yeah.
deficit.
It was a brilliant counter thought.
Yeah,
it
we already voted.
It's not really a counter proposal, it's just a counter thought that the way I read this is that they're suffering from a perpetual lack of inflationary increases, and that has forced them to sort of continually reduce staff in order to be able to balance their budget, essentially.
And meet mandates. The mandates seem to be.
And, yeah, well, they're covering the mandated ones, but
Yeah.
it's forced them to significantly reduce the general legal. And AHS would say they're paying for the mandated services.
Right.
So, for me, I, definitely support the organization and I support the work that they provide. But I don't see this as an adjustment, which is remembering what the BAA is supposed to be doing. So
That's where my mind was, that this sounds like a budget discussion, because it's not gonna go away. Like even if we fund them this year, we're gonna have to be right back, in the BAA, we're gonna be right back here having the same conversation in a couple of weeks about the budget.
Yeah.
And it feels like very short-lived Band-Aid
Yeah.
to a larger systemic problem. And I would encourage us maybe in the budget to think about maybe requiring some regular inflationary increase that is tied to an index that we've done with other programs that, so we're not constantly doing this with various essential programs that serve Vermonters. But that would be more of a budget discussion.
Mhm.
I think the discipline you suggest is probably a good course. I'm happy to pull back on that suggestion I made. I think, well, as Ray has just said, we'll be revisiting it soon enough.
Well, I mean, you made a suggestion, other people have supported that, so,
Yeah.
you know, let's just take a straw poll on the support. Well, I mean, I just I want to be fair to people who might want to express that opinion, so. So the proposal was to fund half of the staff requested, so 150,000 there and 100,000 for the helpline, so a total of 250,000. So that's the proposal on the table. So can I just see by a show of hands those people who would support that?
Reversing course of my. That's okay.
If it's okay, I'll explain my perspective here, which I kind of,
Yeah.
I said a little bit before, but I just don't see this as inflationary, and I totally get that it is obviously a perpetual problem, but I see that argument translating to pretty much every other cause we've talked about. And it's particularly this HUD issue, which, you know, that 1.2 billion that I'm really focused on right now.
Yeah, I think I agree with you in the sense that it's not, when we're talking about an adjustment, they are having to adjust in this. It's not a budget adjustment from what we knew before because the world has changed. And
Right.
so from their point of view, it is an adjustment, yeah.
Well, this impact we knew before.
Yeah.
This wasn't,
That's right.
this is not
That's right.
recent as some of the ones that we're experiencing now. And I do, you know, we're on this committee because we care about Vermonters and we care, not that nobody else does, but I just mean, we have a particular interest in this, and we are going to be faced with a lot of hard decisions. We are not going to be able to replace lost federal funding in every single case, and we're going to have to really think about how that plays out. And so I would urge us to consider this in the FY27 process and see how that stacks up against all the other things that we're going to have to consider. But I see that motion didn't pass, or that didn't not pass, but you know, there wasn't full support for that. So does anybody else want to put anything else on the table? My recommendation is that we not fund this at this time, but that we consider it in the FY27 along with whatever else that they might be bringing forth to us, because they haven't even talked about the disability law project, which is, I know, facing significant strain as well.
I would support that proposal that you just made, that we do not fund it at this time. And I want to lean also on a rationale that you just mentioned. Yes, these are tough times. There's our adjustments that are being made, but it seems like some of these are looking to be supplemented for lost federal funding. I agree with all of these premises. I'm not against them. But we got to be rational and practical that we cannot supplement every agency's loss of funding. I think we should learn from what happened, because we're a little bit in this situation in regards to the hotel program. We chose to continue to run something based off of federal funding, and we kind of put ourselves in a little bit of a predicament, and when we try to supplement state money for lost federal money.
Okay, so can I see a show of hands who would, oh, you got.
No, I
oh,
just
sorry.
wanted to
Yeah.
continue on. I mean, I think that in the budget, we do need to really also talk about the healthcare work that they do.
Yeah, it's broad. I mean, it affects.
It's,
it
the healthcare
affects
advocate is
a lot.
so needed,
Yeah,
especially as our changing landscape with healthcare. So,
yeah. Healthcare advocate is pretty well funded.
Okay.
It might need to be more as we look to the changes in Medicaid and all of that
I
kind of
wanted to
stuff.
include it because it's the same agency.
It's the same agency. Yeah, they do a lot. I mean, they do a lot. Okay. All right, so we have End Homelessness Vermont. request for $100,000 in terms of the support that they provide to individuals with who are homeless, at risk of homelessness, specifically for those who have significant complications with regard to disability. And that request was for $100,000 in budget adjustment. Oh, excuse me.
Now, how would that be paid out? Because, End Homelessness Vermont is under Vermont Kin. So the money would go to Vermont Kin and then they distribute it?
Well, I think that's a very good question, Brenda, because End Homelessness Vermont does not have a specific grant with the state.
Right.
And they do rely as for kind of as a fiscal sponsor to that. So I don't want to say definitively, but if that were to happen, then I believe that that's probably the way it would go. There have been what I would call special circumstances where specific organizations are listed. You know, that money goes directly to that organization in the budget. That they don't like to do that very often, but in specific circumstances that has happened. So, but it would kind of like, we'd worry about how the money got there.
We have to check with Ledge Council though, just to seeing.
They'll give us their
No,
opinion about it.
990. The only 990 is Vermont Kin.
Yeah.
That was filed November 2025.
Uh-huh,
And the last one was whatever.
yeah.
And Homelessness Vermont is under their umbrella.
Mm-hmm.
So
Yeah.
I guess Vermont Kin would, I don't know, we'd have to ask Ledge Council, I guess.
Yeah, yeah. So I think that, you know, one of the things that I want to recognize is that this organization does do something that honestly nobody else does right now. And while I'm not sure it really qualifies under budget adjustment, because it's a new request. I felt it was important that we hear from them to understand the complexity of the cases that they deal with. Because, you know, I suspect we'll be hearing about this during the 27 budget process as well. So what are other people's thoughts?
I'm in agreement.
I'm in agreement for next budget to discuss it. Because like you said, it's not a budget adjustment because it's never been there.
It's not an adjustment. I did want people to be exposed to the, like I said, the complexity of the work that the organization does. And there's literally hundreds of people who would be, you know, facing more dire states than they already are without this organization's assistance. And it might, you know, from time to time, I think they kind of operate a little bit differently than some of the other organizations we're more accustomed to. But I think that's okay. You know, organizations that are run by people who have lived experience have frankly more sensitivity to the issues that people who are going through it right then face. So, and I appreciate
I
that.
think what makes them so successful in, you know, working with this population is that they are able to be nimble and adapt to each household's unique needs.
One of the things I very much appreciate is that every person is looked at as an individual. And it's not just like, okay, well, here's X, Y, and Z. It's like, okay, what is it that you need, you know? And they figure out how to do that in some pretty creative ways, I guess I would say.
And they've forced that kind of cross-silo, cross-departmental case conferencing and communication that we talk a lot about is lacking in our system.
Yeah.
So that's just when I hear the updates and things, that's one thing I especially appreciate is they're doing that really successfully.
So I would recommend that we further consider a request, you know, when we get to the FY 27 budget. But because there is no appropriation for this in the 26 budget, it's not really an adjustment. Are people okay with that generally? Okay. Okay, and then the last one that we are on is 211. Last one I have. It seems like a new request to me.
Oh, that's another new one?
And the fact
211.
that, they're gonna come back and ask for the remainder in the 27 budget, so it feels like it should be something that we should consider as a whole year in the 27 budget.
Right, so if we do it to one, we're gonna be fair. Yeah.
I just do want to reiterate that, you know, we're going to have to figure out the volunteer aspects around
Medicaid.
And I think 211 would be a good fit. And then as well as we often call on 211 when we have a flood, especially in the communities I
Not
represent.
often, we always do.
We always do.
Yeah, yeah.
And so asking them to ramp up
Volunteer.
as the flood is happening is not super feasible. So, you know, in the future, whether with this request or with in the future, we should look to some emergency management partnership on how we.
I was actually glad to hear them say that they are in discussions with Vermont Emergency Management to get funding from them because that's like totally
That's very
appropriate.
appropriate,
Yeah,
Mhm.
yeah. And they haven't been funded by emergency management.
I've also been wondering, as they've been serving as this like call center for GA, and filling in, if there are other places in state government, whether in AHS, where they can be part of that response. Because I know a lot of times we're paying a lot of money for call centers in other parts of the country, and to have that really, where it might make sense to, which helps ensure the long-term success and stability of these essential functions they're already performing, but that could potentially create better service for Vermonters in other areas of our state government and services we provide.
Yeah, and I think of Server also is a potential partnership there with looking at
Yeah.
AmeriCorps programs and how volunteers are
Yep.
engaged in Vermont, whether through emergency management or just even through the Medicaid stuff. So it's still on that.
Is Vermont still operating in light of the federal decisions
Yes.
related to AmeriCorps?
So far, yes.
Okay. All right. So we, again, this will be considered in the 27 budget discussions. So that kind of brings us to the conclusion of the folks that we heard from today. Tomorrow we'll take up the department's recommendations that we heard from. The other thing, I just have an update on the stuff that we talked about first was the ones who were that, we thought were not, the implementation did not meet with legislative intent. So the AAAs and the tier one ERC folks in particular. So Nolan has checked with the department. They say that they cannot do retroactive payments to July 1. The soonest that they could implement a payment would be April 1. So that would reduce the amount that we would recommend. However, he is doing a calculation for us and we'll have that tomorrow morning. Okay. So there'll be adjustments to those two things because they're Medicaid. Okay. Okay. Let's call that a wrap. Tomorrow, in the morning, we have the House floor. Don't forget, we're back to budget adjustment and we are going to take up 545 and continue our markup of 545
And what time will that be? Well, after floor?
right after floor. Yep.
5:45?
Good question. As we go into the budget process, is there going to be an opportunity for us to you were talking about the view that we're going to have to take in the big picture. Is there going to be an opportunity for us to sort of talk about that without looking at specific instances, so that we can get like a set of priorities that we care about or a sense of values that we're working from? I get it. Yeah, for sure.
And
Just maybe some advice as we how we're going to I just think it's going to be really tough
It is.
to go through this.
yeah,
And I think if we could talk about it a little bit together
Yeah.
before we start doing it, it would feel better to me.
absolutely.
Let's do this for me.
Yeah.
I like that.
Favor?
All in favor?
Yes, we can set aside some time to do that, either a little bit next week or maybe the beginning of the following week, just before the governor's budget comes out.
All right, okay.
So it would probably be a good idea to do it before the governor's budget address. So as you're listening to his address, you can hear, to see if our discussions are in alignment with the governor's budget or if there's some differences.
Yeah.
I'll make a note to, put that on the schedule.
Not easy, I know, but.
Okay, Lori, we're all set.